Good afternoon, all. Hope you're well, and thank you very much for joining today's webinar. So today's presentation is around inspection trends. Okay, so this is going to give you a little bit of an insight into what we do as a business, and hopefully it'll give you a little bit of an insight into what CQC and HIW are looking at presently, or at least what they've been looking at for the last 10 months. So a little bit about myself. If you haven't joined these webinars before, one's presented by me. My name is Rhys. I've been working in the dental industry now for over a decade, predominantly as a health and safety advisor, and then moving into the wider compliance role, looking at all elements of compliance. Been working for Agilio for the last year as a deputy head of compliance. I'm responsible for managing all the policies, the procedures, keeping everything up to date in the system, and ensuring that that information is relevant for our members who are using iComply and iManage. So my role is to keep all that document up to date, keep it relevant, keep you guys informed of what's changing out there in the regulation world. And this is where this webinar will come into play, to show you how I put together all that information and keep things up to date. So what I want to do with the course of this webinar is I want to look back at the last 10 months of inspection reports across both CQC and HIW. So January to October this year. Every month we collate, we jump onto the CQC HIW website and pull off at least 10 reports every single month for both regions. In Wales, obviously, because they haven't got as many practices, we don't get to see 10 reports, but I will pull off whatever reports have been released that month. In England, because they've got a lot more practices, we generally look at 10 reports each month. And the purpose of that is to identify the trends. So look at what inspectors are looking at, what sort of topics they are focusing on, and what sort of evidence they're looking at as for those in particular topics. We look at areas of concern, trends that they are picking up as part of their reports. And we put all that into a big database and then use that database to extract figures and patterns and areas of concern, and to help us then to put things in place and to preempt as well. What sort of documentation, what sort of concerns they're raising that we may need to put in place within our compliance solutions for our members. So I'm going to look at the past, the last 10 reports. I'm going to then present that into a table format then, so you can see the top 10 problem areas for both England and Wales from 1 to 10. And then I'm briefly at the end of this webinar then going to look at the new frameworks that have been introduced by HIW, and we are waiting to be introduced by the CQC. And I'm going to give a brief summary then of what new trends we envisage are going to come out of those frameworks. So to start with, you can see here, I've got two tables, England and Wales, 1 to 10. And I got the percentages as well that you can see. So these percentages reflect the total number of reports we've looked at. So for England, I'm looking at 100 reports over the last 10 months. For Wales, I'm looking at 34 reports. That's how many reports they've released this year. Okay, so it's not that we haven't done as much work for England. That's the only number of reports that we've got to work from. 34 in Wales that have been released so far to date. So out of those 134 reports, you can see the percentages down there. Okay, and in the middle of this slide, you can see 20 topics that we pull and extract from the reports. And these topics are mirrored across both regions. So these are all the topics that the inspectors will look at as part of their inspection frameworks. So during the course of this, those topics are going to fall into the table so you can see where they lie and where they present in relation to worst to least concern. Okay, so just put into your chat at the moment. It'd be interesting to know what topics you think will come out on top for your regions, England and Wales. Just put into the chat, out of those 20, which one do you think is going to be the most problematic topic? Let's have a quick look to see what your thoughts are on this. Be interesting to know. Anyone got any, like to take a mental health, okay, fire safety, appointments, safeguarding, IPC, okay. safeguarding a few times, infection prevention. Right, they're all coming through now. Okay, so we've got a bit of a broad scope of views on this. Infection prevention, safeguarding, I can see is coming up probably the most. Right, okay, so let's crack on. Let's see what actually the trends show then. So the first one, as you can see, appointments, that's been greyed out. So that hasn't come into the top 10 for either Wales or England. But that's not to say that you should ignore that. Appointments are still being looked at by both inspections. They want to see that you've got systems in place to manage your recalls, to manage your appointments based on the risk assessment approach, the risk of the patient on their oral health. And they want to see that you've got effective systems in place for emergency appointments and out of hours appointments as well. So they want to see all those systems in place, but they're not flagging that up as part of their inspections at the moment as a problematic area. So don't ignore it. They're still looking at it, but it's not one of the top 10 concerns. So cleaning's next. And as you can see, that goes into Wales in 8th position. Okay. In England, they're still looking at cleaning, but it's not being flagged up as a common area of concern at the moment. In the middle now, you can see the sort of evidence trends that are associated with cleaning. So again, these evidence trends are associated with both England and Wales. So again, if you're English practice, don't ignore these just because it's not in the top 10. They are still looking at these sort of things when they come and do your inspection. So they want to see that you've got a cleaning schedule in place that details how often you're cleaning the areas you practice, with higher risk areas being cleaned more frequently than lower risk areas. They want to see some sort of cleaning checklist in place to ensure that you're keeping on top of the standards. They will look at your storage arrangements then to make sure that your equipment is being stored appropriately. You're not cross-contaminating yellow mops with red mops and vice versa. And they will also look at your housekeeping arrangements as well to ensure that you're not cluttering your practices, that you haven't got boxes and excess storage and archive and all that in areas where people could trip over them, especially patients and stuff. So those are all the sort of evidence trends that both inspectors are looking at under the topic of cleaning. But in Wales, they're flagging this up as a little bit more of a concern than in England at the moment. So this, again, is to show you the differences between how the two regions regulate and where they're focusing their attention. So after this, we got complaints. So again, complaints goes down into the 10th position for Wales. So again, England are looking at this, so don't ignore it. Both inspectors want to see that you've got a complaints procedure in place. That is a legal requirement to have. And that complaints procedure must be displayed to your patients. It must be available to them in a format or an area of your practice that is accessible. So it could be displayed, it could be in a patient folder, it should be on your website, in your patient leaflet. They want to see that you have a complaints log in place, that you're monitoring those complaints, you're recording them, and then you're doing some sort of complaints analysis. This comes up quite heavy in Wales because they're quite focused on you responding on those complaints and sharing those responses with patients accordingly. And that's why it's been flagged up in 10th position. So they're looking at that in a little bit more detail at the moment. In Wales as well, they are expecting your complaints process to correspond to the putting things right, especially for NHS practices. So your complaints process, if you're an NHS practice, should be making reference to putting things right. That doesn't apply to England. That's hence the little Welsh flag. That's only for Wales. So next we have COSH. COSH goes down into 10th place for England, not for Wales. So again, they are looking at it in Wales, but they're not flagging it as a concern. In England, they do go into the COSH arrangements a little bit more detail. They are very, very active on checking your COSH risk assessments in England. They want to see that you're doing risk assessments and that you've also got your material safety data sheets available. So both assessment and data sheet should go hand in hand, and both of them should be accessible to your staff. And they will also check then your storage arrangements, and they're making sure that none of your COSH products are being accessible or are accessible to patients. You're not storing any in the toilet facilities or other areas of the practice, your waiting rooms where patients have easy access to them. And also that the products are being stored appropriately, i.e. flammable substances not being stored next to sources of a heat or ignition. So again, they will look at the arrangements. They will proactively look at how you're managing the risks with them. So dental care records is the next, and that goes into top position for Wales. Doesn't come up on England. And part of that reason may be because of the fact that a dental care record audit is a statutory requirement in Wales, whilst in England, it's only an optional requirement. So inspectors will still look for an audit in England, but they like to see that as part of your quality improvement, whereas in Wales, you categorically have to be doing that audit. So that's why we're seeing that coming up higher in Wales than in England. The other reason for that in Wales is something to do with, I'm going to go into this a little bit later, but Welsh-speaking patients. Okay, what they like to see in your records in Wales is having their preferred language choice being recorded. And that is probably one of the biggest downfall areas of practices, that they're not recording patients' preferred language choice. So again, I'll go into this a little bit more detail in a few slides' time. But they will also look at you take a sample of records. You will usually take a sample of around 10 to 12 records in both England and Wales to make sure that the details logged on those records correspond to the GDC standards and FGTGP guidelines. Okay, so again, they are looking at this in England, but there's more focus on it in Wales at the moment because of the statutory requirement. So we have equality. So this is all about the Equality Act, making reasonable adjustments, considering those with impairments. It's been looked at in both remits, but it's not been flagged up as a major concern at the moment. Again, don't dismiss it. Ensure your practices are accessible to patients and that you have considered their needs, whether they've got mobility impairments, hearing impairments, visual, or mental health issues. You have to consider their needs and adapt your arrangements to suit that. So equipment and facilities is the next, and that goes down into 8th position for England. But again, Wales will look at this. So all the things here, they will both ask for as part of their inspections. Maintenance records. Make sure you have up-to-date maintenance records for all your equipment. In particular, what I've listed here are things that come up a lot in reports. Autoclaves compressors, your EICR, that's your hardwire electrical installation. So your fixed wire testing, that needs to be done every 5 years. Any gas appliances you have, so not just your combination boilers. If you have a gas supply for Bunsen burner use, if you have a gas cooker, a gas fire, those gas appliances need to be inspected on an annual basis, and they will ask for certification. Portable appliance testing, PAT testing, they will ask for as well. And pressure vessel inspection certificates. So that's your compressors, autoclaves. The pressure vessel inspection is different to a service. It's the equivalent of an MOT for your car. It's to determine that the equipment is safe for continued use. So they'll want to see a service report for your autoclaves and compressors. They will also want to see a pressure vessel inspection report, a PVI. In Wales, they like to look at your toilet and changing facilities in particular. So they want to make sure that you've got a suitable toilet facilities for both staff and patients, and that you have suitable changing facilities for your staff. So in Wales, those two things come up on reports a lot, whereas in England, we don't generally see those things come up on reports. Toilet and changing is a requirement across all regions of the UK. It falls under the welfare work regulation, so you are still required to provide toilet and changing, but the Welsh inspection regime particularly focuses on that and puts it in their reports. So now we have feedback. That goes into Wales, number 4. Again, in England, you need to be obtaining feedback from your patients to show how you're managing improvements. And there's many ways of doing that. So what I've put on here are suggestions. There's no one fit for all. You can pick and choose what is relevant for your practice. The patient surveys, requesting patient feedback through social media reviews, so Google reviews, through your website, suggestions, comments box in your practice, and they will look for how you're doing that and how your method and systems of obtaining feedback. I would say we have recently seen on an inspection report a practice only use social media avenues for obtaining feedback, and that was flagged as a concern because not all people have access to the internet. So they wanted to see another method as well as social media. So it's nice to have online ability, but then a physical ability to obtain feedback as well. And inspectors like to see a you said, we did functionality. So what this is you said, we did, obtaining the feedback and then putting processes in place to manage that feedback and act on it. And more importantly, share what you've done back to the patients. So they like to see that you've put some sort of you said, we did poster on display or on your website about promoting. You said our toilet facilities were too small. We have, as part of a recent refurbishment, enhanced the size of our toilet facilities. Just explaining that, showing people that you're taking their thoughts on board and you're doing something with it. And that is quite prominent in the Welsh inspection reports. They are quite heavy on the you said, we did requirement. And in England, as you can see at the bottom, friends and family tests. So if you're an NHS contract, you are expected to use the friends and family test forms for a method of obtaining feedback. So again, if you're NHS, get yourself familiar with that and use that in your practice to satisfy the inspections. Fire is the next one, and that goes into both. And in England, that is top. So fire in England is the biggest concern at the moment. Out of 100 reports, 71% of them, fire has been raised as an issue. And I recently did a webinar on fire safety because of this trend as well, which shows why we're doing this work behind the scenes to identify what's relevant, what is current. And as I just mentioned, a couple of months ago, I did a fire webinar purely on that topic to explain what inspectors are looking at. So if you haven't seen that, jump on our YouTube webpage, and I recommend you have a look at that website that go into more detail. But yes, fire is a problem area, and it's 5th place for Wales. So they're proactively looking at it as well. All those pieces of evidence you can see in the middle are things they will look at during their inspections. Fire risk assessment is the top one. They will always look at fire risk assessment, and they will want to see that fire risk assessment has been done by a competent person, that any actions from the fire risk assessment have been acted on, put in place, and then you're monitoring that and renewing it as required, particularly where there's been significant changes to your working operations or the layout of your practice. They will want to make sure that you've got a suitable fire detection system in place, emergency lighting system, firefighting equipment. They'll want to see that you're doing your weekly, monthly visual checks and testing on the equipment at practice level, and that all the equipment you've got in place is being maintained and serviced. Fire drills comes up quite a lot on reports, both England and Wales, where practices are failing to do them or not doing them effectively. So that's a common trend. And then obviously that you've got written fire safety procedures and fire marshals in place to help manage and put all this into place at your practice. In Wales, they are particularly focusing on the no smoking signage as well. So again, in England, you have a legal requirement to display no smoking signs, but in Wales, they always put this into the report. So they are looking at no smoking signs consistently as part of their inspection. So make sure you have a no smoking sign displayed. Now we have infection prevention and control. So again, this isn't top of the list, which may surprise some people. It is 3rd in Wales, it's 5th in England. I think the inspection regimes have moved on. When CQC, HIW first came out, infection prevention was their main focus. Now they're looking at other areas. They're still looking at this. They still want to see that you've got these things in place, a policy, that you've got all the decontamination processes in place, that it follows HTM 0105 and WHTM 0105 for Wales. But they seem to be a little bit more content and happy with things at the moment. The biggest downfall with infection prevention and control is the audit. It is the audit either not being done or not being done effectively. And what I mean by that is it may be getting carried out, but it doesn't reflect things that are going on at practice level. And inspectors have flagged that up quite a few times, where the audit has said that practices have implemented a certain way of doing something, but actually when they've gone around and asked staff, they've contradicted it. So make sure your audit reflects what you're doing. Otherwise, inspectors they're not stupid, they will find that out. You need to have suitable hand washing facilities and hand hygiene procedures as well. So they will look at all these sort of things. Next, we have medical emergencies. And this goes into both 6th and 4th, as you can see. They will always look at medical emergencies. They will make sure that you've got a suitable emergency drugs kit and resuscitation equipment available in line with the Resuscitation Council. Now, that doesn't really come up as a major issue. A lot of practices have those, if not all the practices have an emergency equipment list, emergency equipment available. But where they're falling down is doing the weekly checklist. More often than not, the inspectors will check the equipment and will find things that are out of date. So please ensure that you've got your kit in place, that you are doing your checklist, and you have got a process in place to make sure that everything is in date and not missing, because that's where practices are falling down with it. They want to see that you have emergency procedures in place for dealing with medical emergencies and emergency collapse. And obviously your GDC requirement for your basic life support training. In Wales, they are paying a little bit more attention as well to subsidising that training with first aider training. So as well as having your annual basic life support training for all your team members, in Wales, they like to see that you have a suitable number of appointed first aiders. So again, you should have first aiders if you're England, but the Welsh inspectors are focusing on that a little bit more than what the England inspectors are. They like in England, they're predominantly focusing on your basic life support training. But don't ignore it if you are in England, because that may come up in future inspections. Next, we have medicines. So that goes into 2nd position for England. Doesn't come up as a concern in Wales at the moment. But again, all these things apply regardless of where you're based. So you need to have a medicine management policy in place. If you have prescription pads available and you're using them, they need to be stored in a secure manner so they can't be accessed by unauthorized persons or stolen for malicious intent. If you are storing medicines in a fridge, a designated fridge, you need to have a temperature log in place to ensure that those medicines are kept within the required temperature regime. And you should be undertaking an antimicrobial prescribing audit. So this is an optional audit. There's no statutory requirement out there for you to do this audit. But saying that, both inspectors in England and Wales like to see this audit in place as part of quality improvement to ensure that you're managing medicines appropriately. And more often than not, that's why this comes up as an issue in the inspections, because they always put an antimicrobial prescribing audit as a recommendation, and they will always look at that or ask for it during their inspections. And also that you're monitoring your medicine stock as well. So make sure that you've got a process or system in place for stock control. Patient information is next, and that goes into 2nd position for Wales. So patient information, generally for both practices, your medical histories, patient information leaflets, your practice website, make sure all that information is up to date and it's relevant and it reflects the exact treatment options and processes that you're providing at practice level, because they will cross-reference both of them. You also need to ensure that your price lists and fees are made accessible to patients, whether that's displayed at practice level, displayed on your website, communicated in your patient information leaflet, or other avenues. But all that has got to be accurate and reflective. Now, this comes up as 2nd in Wales because there's something called more than just words. Now, this doesn't apply to England, so you can shut off for the moment for the next 30 seconds. But in Wales, more than just words is the Welsh government's plan to strengthen the Welsh language. It started last year and it's going to run until 2027. So there's certain targets over the next couple of years that they're going to be forcing through the healthcare sector, and this has been endorsed by the HIW. So they're looking at this as part of their inspection trends. But essentially, if you have patients whose preferred language choice is Welsh, they want to see that you are providing an active offer, and that is promoting the availability of Welsh at your practice without patients having to ask for it. So if you've got Welsh speakers, they should identify themselves by wearing a badge called Iaith Gwaith. It's a little orange speech bubble with the word Iaith Gwaith in them, and that stands for work in Welsh. So they should identify themselves as Welsh speakers. You could either also put that badge in your window to display you as a Welsh speaking practice. And all your written communication then, which is accessible to patients, so like your patient information leaflet, and other versions of patient-facing documentation should be available bilingual in both Welsh and English. So at the moment, you're in a transitional period to try and put all these things into place. But by the end of 2027, every healthcare operation in Wales is going to be required to have all this in place and to have staff able to speak courtesy level Welsh. So that's just basic Welsh, being able to say hello, thank you, communicate, explain to people that they understand Welsh, can talk basic level. So there's things coming out. Don't panic about this just yet, because the government is still putting the framework into place. The HIW are using their inspections to identify where practices are at the moment, and then more will come out on this. So we're monitoring this at the moment to determine what the targets are going to be and what impacts that's going to have. And that links back to my dental care records for Wales as well, because that's where the preferred language comes into play. And that's why dental care records has come out as top of the list, because of the preferred language is not being recorded. And they want to see that proactively being considered now as part of this more than just words government scheme. So next, privacy and confidentiality hasn't come up as a concern. This is all about how you manage your patient records. If you've got paper records, they should be stored securely, filed away in lockable cabinets. Your electronic records should be backed up regularly. So if there's an issue with your computer system, you've got those records still available, but it's not been flagged as an issue. So not something urgent to focus on at the moment. Radiation is next, and that comes up in both 9th for Wales, 3rd for England. They will look at this, and they will look at all these pieces of evidence as part of their inspections. So they want to see that you're doing an image quality audit, 6 monthly, that should be done. They want to see that you've got radiation procedures in place. So that will be your radiation protection file. Routine assessments and maintenance reports for all your X-ray equipment. HSE registration certificate, so you should have that available, and then your radiation protection training. So all those things I've listed, they will actively look for and ask as part of their inspections. In England, inspectors like to focus a little bit more on the rectangular collimation than what they do in Wales. It's not a statutory requirement that you use collimation, but that is a way of reducing the dose levels when you do an exposure. And effective radiation management is all about reducing the level of exposure as far as is reasonably practicable. So rectangular collimation is a way to do that. Inspectors like to see it. So they do commonly mention that as a recommendation in their reports. Recruitment next, that goes into England in 7th position. Again, Wales will look at this as well, so don't ignore it. Recruitment policy procedure. Legal requirement to have a recruitment policy, so make sure you've got that in place, it's up to date. And that your staff recruitment files, so you're doing all the necessary checks on staff prior to them joining the business, and you've got evidence of those checks in place. All your clinic staff need to be GDC registered, so they will look at that in particular, and they need to have professional indemnity cover. So those are the two things in particular that they will focus on: GDC, indemnity, and DBS is the other one as well, which I've mentioned there. So recruitment, make sure you've got that in place and you're managing it effectively. Now we've got risks to patient and staff safety. So this is general risks now. And the things that come up under this category in the reports for both regions are sharps. Sharps will come up as a risk. They want to see that you've got a sharps policy in place, and they want to see that you're using or have considered safer sharps as an alternative. If you're not using safer sharps, you must be able to justify that decision through an effective risk assessment. But it's very hard to satisfy them through that method, because their focus is that you should be using safer sharps to comply with the relevant safer sharps regulations that were released by the Health and Safety Executive. You need to have an inoculation injury protocol in place, and that should detail how people access support and advice in the event of an injury. So if you haven't got occupational health in place, then that needs to detail your local emergency department. They will also look at lone working risk assessments as well. So that's not just for external people, usually your cleaners. But if you've got members of the team that may be working on the premises at any point during the working week on their own, they want to see that those risks have been considered. And that also includes whether you're working without chair side support. So if that's a case in your practice where you're not working with a nurse, they want to see that those risks have been assessed, identified, and appropriate measures put in place to mitigate those risks. And then they want to see that a general health and safety risk assessment has been undertaken for your premises to cover all potential hazards. And again, like your fire risk assessment, they want to see that that's been undertaken competently. They want to see that the actions and outputs of that have been dealt with, and it's not just been done as a tick box exercise, but acted upon, and then reviewed continuously going forward. So general risks will be considered by both inspectors, and those are those particular topics or piece of evidence they will look at. So safeguarding, that I'm sure will surprise people, has not come up as a concern in either region. So they're quite happy with how safeguarding is being managed across England and Wales at the moment. We rarely see any concerns come up on this. There's generally safeguarding leads in place at the practices. Generally, you will have a safeguarding policy and procedure in place, and all staff will be trained to the appropriate level. Level 2 is required for safeguarding. Level 3 training is recommended for safeguarding leads, but it's not essential. So as long as you've got level 2, you've got your policy, and you're managing that appropriately, that is fine. And it's not being raised as a concern at the moment in time. Next, we have waste. So obviously, waste has changed recently as following the new or updated HTM 0701 document. But at the moment, it hasn't come up as a concern. So they've been happy with how waste has been managed to this point. But we do envisage that's likely to change going forward because of the new HTM. So I'm intrigued in 6 months' time when I do this trend analysis again on the back of our data, whether or not waste will be in the top 10 list based on the new structure of how to segregate and manage waste. But at the moment, it doesn't look like you need to focus on that just now. So the last one that goes in is workforce for England. So again, in Wales, you need to make sure that your workforce is trained and appropriate. They're competent, they're suitable for the responsibilities, that you are undertaking appraisals and that they're being undertaken at least annually. You are having staff one-to-one meetings to discuss their personal development plans, give them opportunities to learn new things or to be vocal about where they're struggling. You need to make sure that they're all up to date with their mandatory training and their CPT records are available. And you need to have in place some sort of training matrix as well, a system to keep on top of those training records. So that could be an automated digital system. That could just be a manual system where you request them to give you their hard copy certificates every time they do training to put in their personal records, the personal files, but you need to have some sort of system in place to manage that. And that is one of the biggest downfall areas, is that practices are not routinely monitoring their staff. They're putting the onus on the staff to do the training, but they haven't got that system in place to keep on top of it or to give people a nudge when a particular training certificate is coming up for expiry. You also need to ensure that you have a suitable induction process in place for your team as well, and that induction process is being recorded and held on file for evidence purposes. Now, in Wales, there's a bit of a difference to things in England, but job descriptions and contracts of employment are a statutory requirement in England, whereas they're not at the moment they're statutory requirement in Wales, whereas they're not in England. So inspectors will proactively, as part of their recruitment and workforce regime, look for job descriptions and contracts of employment. So in Wales, please make sure you've got them in place for all your members of the team, because they will be asked for. So we can see now the finalised lists for both England and Wales. We can see the difference between the two regions, what they focus on, the areas of concern. And it may surprise you, the table, how they've been formulated. Fire being the top in England, dental care records being the top in Wales. We find this is what we use now. So we use this information going forward. So we know where to focus. And like I said earlier, we identified fire as being one of the problematic areas. So we did a webinar on that. We will base our webinars on these sort of trends going forward to keep it relevant to you guys and to help you guys know what inspectors are looking at and where the areas of concerns are. Now, I've obviously gone through a lot of information here, and I've briefly skirted over the evidence trends without going into them in too much detail. I would have loved to, but by going through all these evidence trends in a lot of detail, I would have kept you here all day to do that. So we will focus our future webinars on particular topics, like I did with fire, and then delve into these sort of things a lot more. At the moment, we've got quite a few solutions with Agilio to help you with all these sort of things and put them in place. The workforce that we're looking at now, for example, if you need help or support with workforce, we've got our IT solution, which is all about a digital system for monitoring staff rotas, monitoring your training records for the teams. It automatically gives you reminders when those training are coming up. So we've got lots of solutions to help you with this at the moment. I know there's a lot of members already, Agilio members on this webinar at the moment with us, but we have got more than just one possible solution to help you. So whether you're an iComply member, whether you're an iManage member, an iTeam member, maybe you're not a member of Agilio at all at the moment, but if you want help or any more support on how you can put these sort of things into place and what sorts of support solutions we have available to help you implement all these sort of things that I've discussed, then please feel free just to give us a call. That's all we ask. Give us a call. We can discuss the options with you. We have 14 ex-practice managers working for Agilio. So we've got people who have been in your position, who understand how difficult it is sometimes to implement compliance at local levels. So they'd be more than happy just to have a frank discussion with you on this. There should be a pop-up at the moment on your screens. So if you want to have a little bit more information support or ask any further questions on any of these particular topics, whether if you're already an iComply member, you will have access to our helpline and they can give you help on this. If you're an iManage member, you will have an appointed iManage account manager who can help implement these policies, help implement these procedures, help you formulate them, put them together. Please give us a call and we can delve into this a little bit more information and give you a little bit more support as you need it. So just to move on from that, I want to look at the future very, very briefly now. And as we know, or hopefully as you know in England, CQC have been discussing a new framework for the last 12 plus months, the single assessment framework. As you can see here in the pyramid graph, that is the structure of the new framework. They are keeping with their 5 key questions. So that's safe, effective, caring, responsive, well-led. They are keeping that. But they were replacing the existing CLOEs, so key lines of inquiries, and there's 23 of them at the moment. They're replacing them with something called a quality statement. And there's 34, or there's going to be 34 new quality statements. Or what they'll be referring to them as is we statements. Okay, so they're statements dictating what you were doing to put something in place. So for example, we ensure that we safeguard all our patients by, it's a statement. I can't remember the word for word, but it's a statement to manage that particular outcome. So they'll have a we statement for safeguarding, a statement for infection prevention, a statement for consent, and other things. Now, not all 34 statements will be applicable to dental. Some of those will be applicable to hospital and other care environments. So they will pick and choose what quality statements are relevant for what industries, what sectors within healthcare. But at the moment, we're just waiting on them to release a little bit more information on how those statements are going to tie in with the evidence trends and what sort of new pieces of evidence they're going to be looking at. So there are some things that we envisage will come out of this new framework. We have already, as part of our work behind the scenes, identified that they're going to be looking at environmental sustainability a lot more. So this is all about protecting the environment and how you're putting things in place at practice level to support that. And this is where I think that waste strategy will come into play, and where we'll see that being flagged up a lot more, because the whole new HTM around waste is about protecting the environment, reducing your carbon footprint, reducing carbon emissions. So I think, I'm taking an educated guess here, that under the sustainability quality statement, waste will come into that a little bit more. They've also got a quality statement around freedom to speak up. And freedom to speak up is tagged into whistleblowing. Whistleblowing is about protecting people who raise concerns. Freedom to speak up is encouraging people to raise those concerns and then managing those concerns in a proactive manner without finger pointing or pointing blame or anything like that. It's about listening, taking on their concerns and making them feel valued by raising it. So again, the new framework has a whole new quality statement around freedom to speak up. So again, we envisage that will become more prominent, and likely there'll be some sort of training requirements, maybe some policy requirements around it, but we're keeping tabs on that at the moment. And if we identify things, we will release that in advance. And the last thing the new framework is likely to bring in as well, and I've seen this come up in the chat function, is autism. As we know, earlier in this year, autism training, the Oliver McGowan training and the Paul Ridd training for Wales, it applies to both regions, has been introduced into the healthcare sector. And all healthcare establishments now are required to provide training to their staff around autism and learning disabilities. Now, at the moment, the Oliver McGowan and Paul Ridd for Wales, they're mandatory training. They're not the statutory training requirement just yet. There's a consultation going on at the moment between the CQC and the relevant governments on what the training framework should consist of. That consultation ended this month, so we're waiting currently on the outcomes of that to find out what is going to be the expectation going forward and what practices must put in place to meet that requirement. So at the moment, all that's coming out on the reports is identifying what the inspectors are looking at is, are people aware of autism and have they got some sort of informal training mechanism in place to just start raising that awareness of it. But that will be formalized going forward, and we are waiting to see what comes out of that. In Wales, they've already implemented their new framework. So the Health and Care Quality Standards 2023 have already replaced the pre-existing Health and Care Standards 2015. They were brought into play April, May this year. And over the last couple of months, the HIW have been transitioning their inspection reports and their inspection framework to mirror these new standards. So historically, you had 7 quality themes, which is that first wheel you can see. And the quality themes are the coloured segments in the middle. That has now been replaced by the new framework, which is the secondary wheel you can see. And you have 6 domains of quality, which is the outer circle. And then it's supported by 6 quality enablers, which is the inner circle. So that framework has already been adopted, and they have now transitioned their reporting structure to marry that. So we are already monitoring what's coming out of that framework. And things that we are starting to see as part of that is duty of candour. Duty of candour now has become very, very prominent, and they expect all Welsh practices to have a written duty of candour policy and procedure in place, and that staff are trained on that and made aware of it. They are moving towards digitalization of records and documentation. So they're trying to encourage practices now to move away from paper records and put digital systems in place. So again, this links into the environmental sustainability and where we are as a world trying to minimize carbon emissions. They are also looking at the language. Communication and language is a brand new part of their framework. So this is where that strengthening the Welsh language falls into play. So they are proactively now looking at how you are considering people whose first language may be Welsh and what you're putting in place to support that. And just to give you a little bit more on that, it's not just about obviously supporting Welsh as a language because we're based in Wales. this ties into equality. So obviously, where older people who have been born and bred speaking Welsh, unfortunately, in some situations, especially in cases of dementia, where they're losing the ability to obviously think and remember things, they have been found to revert back to their native tongue, which is Welsh. So this is all about reasonable adjustments and the equality side of things as well, to help people who are reverting back to the natural tongue in Wales to be able to speak and communicate in that tongue when they lose the ability to speak in English, which is to them a secondary language. So again, some things we are already starting to see in Wales, and we are keeping on tabs on that now, and we will be gradually introducing that into our iComply software solution. And what we are starting to do now is regionalize a lot more of our content to make it Welsh specific, to separate the England and Wales. So when you're in your cycle, you're not seeing the two combined. If you're Welsh practice, you are specifically seeing your Welsh information. If you're English, you're English. So that's an ongoing project to link into this new framework. So I hope that was beneficial to you all. I hope you found that useful. As I said before, please feel free to get in touch if you want any more information. If you're already a member and you want more information around some of the topics I discussed, please call us, speak to our helpline, speak to your iManage, and we can elaborate on that a little bit more. If you're not an existing member and you would like some more information on how we could potentially help you with the services, and again, please drop us a call, and we'd be happy to offer that support to you. So thank you very much, all. Appreciate your time. Hopefully see you again. Bye-bye.